Thank you very much for your interest in and support for the recovery trial, and welcome to this background training material. As you probably know, a novel coronavirus-induced disease was identified in China at the end of 2019, now called COVID-19, which is caused by a novel beta coronavirus called SARS-CoV-2. Although the majority of people either have no symptoms or a mild disease, a minority get severe pneumonia and require hospitalisation. It's been estimated that in the UK, about 5% of those infected may need admission to hospital, and of these, up to 30% may need intensive care. The progression from a viral prodrome to more severe disease takes 1 to 2 weeks, offering a therapeutic window. The recovery trial has been recruiting patients since March 2020 and has already demonstrated that amongst patients hospitalised with COVID-19, neither hydroxychloroquine nor lopinavir/ritonavir reduce the risk of death. It has also shown that dexamethasone does reduce the risk of death significantly among patients receiving oxygen or on ventilation at baseline. The trial continues to investigate other treatments in adults, including azithromycin, convalescent plasma, synthetic monoclonal antibodies, and totalizumab. And if you're involved in the treatment of children, the treatments are slightly different in recovery, so please watch the separate training video. Patients are eligible for recovery if they have been hospitalised for proven or suspected SARS-CoV-2 infection, and they have no medical history that might, in the opinion of their doctor, put them at risk if they were to participate in the trial. The outcomes for the trial include the primary outcome of all-cause mortality by 28 days after randomization, and secondary outcomes including the duration of hospitalization, and among patients not on ventilation at baseline, the need for mechanical ventilation or death. Subsidiary outcomes include the need for and duration of other types of ventilation, renal replacement therapy, and cardiac arrhythmias. Azithromycin is a commonly used antibiotic in the macrolide class, which is thought to have antiviral and immunomodulatory properties. The main contraindication to azithromycin is a known long QT syndrome or allergy to macrolide antibiotics, so it is not suitable for patients known to have those conditions. The main side effects include prolongation of the QT interval and interaction with other drugs such as cyclosporin or digoxin, so azithromycin should be used with caution among patients receiving these drugs. Convalescent Plasma has a separate training video, so please watch this if your site is participating in this part of recovery. This convalescent plasma has been collected by NHS Blood and Transplant from people who have recovered from COVID-19, and the plasma contains a high titer of anti-SARS-CoV-2 antibodies, and it is hoped that donating these can aid recovery in patients hospitalised with COVID-19. Synthetic monoclonal antibodies have also been developed against the SARS-CoV-2 spike protein, and similarly it is hoped that these may also aid recovery in patients hospitalised with COVID-19. Again, there is a separate training video, so please watch this if your site is participating in this part of recovery. Since the 6th of November, recovery has also been assessing aspirin, which is a commonly used antiplatelet agent which also has some anti-inflammatory properties. The main contraindications to aspirin are a known hypersensitivity, or a recent major bleeding episode, or other bleeding risk which is considered too high for aspirin treatment to be safe. The main side effects of aspirin include bleeding. It is important that participants entering this comparison do not have their other venous thromboembolism prophylaxis influenced by their allocation in this randomization, and gastroprotection can be used at the discretion of the managing doctor. This trial shows how all of these different treatments fit together in the current trial design. So patients, as they enter the trial, are randomized into at least one of 3 simultaneous randomizations. Part A is a randomization between azithromycin and usual care alone. Part B, which is the antibody-based treatment randomization, is between convalescent plasma or the Regeneron monoclonal antibody cocktail or usual care alone. And Part C, which is the thromboembolic randomization, is between aspirin or usual care alone. All participants are then followed for 28 days or until death or discharge if it occurs earlier. And for some patients, those who are hypoxic and inflamed, there is a second randomization, which we'll come back to later. It is important to note that if an individual study treatment is contraindicated for a given patient or is unavailable at your hospital, the patient can still enter the trial and be randomized to one of the other available and suitable treatments, and the computer system will allocate them accordingly. The randomization is simple. In other words, there is no stratification or minimization. As mentioned earlier, there is a second randomization on the right-hand side of this slide for patients who meet certain criteria, and there is a separate training video about this, which I suggest you watch if your centre is participating. Patients are eligible for this second randomization if they are both hypoxic, in other words, they are receiving oxygen or have oxygen saturations less than 92% on air, and they also have an elevated CRP of at least 75 milligrams per litre. And again, there is no medical history that might put them at risk if they were to participate in this aspect of the recovery trial. Given the agent, which is Totalizumab, which is being tested, the main such criteria might be clear evidence of a secondary bacterial infection causing the deterioration which Totalizumab may exacerbate. Totalizumab is a humanized monoclonal antibody against the interleukin-6 receptor, and it is currently used for the treatment of rheumatoid arthritis and the cytokine release syndrome following CAR T-cell therapy in certain hematological malignancies. The main side effect of Totalizumab is other infections, as would be expected from its mode of action. So while COVID-19 is a mild disease in the majority, a significant minority do require hospitalization and face significant risks of morbidity and mortality. The recovery trial is currently testing azithromycin, convalescent plasma, synthetic monoclonal antibodies and tocilizumab to assess their effects on major morbidity and mortality amongst adults hospitalized with COVID-19. And as a platform trial, other arms may be added in the future. Thank you very much again for your attention and for your support for the recovery trial.